Hello everyone! This will serve as an overview for the Healthy Monday National Initiative and also the current projects that the Syracuse University Learner Center is taking part in. So to start, the Learner Center at Syracuse University is based in the Maxwell School. Our mission is to improve population health through applied research and evaluation, education, engaged service, and advocating for evidence-based policy and practice change. Our vision is to be a nationally recognized center for our rigorous population health research, community engagement, and student training, and we are guided by our values of community engagement, partnership and collaboration, and sustained partnerships through our aligned goals. Healthy Monday is the signature program of the Learner Center, and it came about because in 2003, Sid Lerner, this man in this picture, connected with researchers at Johns Hopkins to revive the Meatless Monday campaign from World War II, and Hopkins then developed research to develop the Monday effect, which was used to develop the Healthy Monday campaign and a range of health promotion efforts. Sid then went back to his alma mater, Syracuse University, and developed a relationship here. So in 2011, the creation of the Syracuse University Learner Center happened, where the center first tailored their initiatives to focus on nutrition, physical activity, and emotional well-being. And thus, the Healthy Monday campaign was born. So Healthy Monday is a national initiative to help the stop of chronic preventable disease by offering a weekly tip or prompt that can support people and organizations in not only starting a healthy behavior, but also sustaining that behavior. At the Syracuse University Learner Center, we have many Monday programs. They are Meatless Monday, Movement Monday, and the Monday Mile, De-Stress Monday, and Quit and Stay Quit Monday. So you may be asking yourself, well, what's the big deal about Monday? Why do we keep talking about Monday? Well, in our Western world, the week is a really significant unit of time in shaping our human life and our day-to-day. If you think about how many times you use the phrase a week in your casual conversation, it's actually quite often. You might say things like, oh, I'll get to that next week, or that's not due for a few weeks, I have some time, just showing that this unit of time really is embedded very deeply into our culture. And Monday has a special significance in our Western culture as the start of the traditional work week and school week. People use Monday as a health day already, and health promotion at the beginning of the week has the potential to reduce negative health events later. The periodicity of the 7-day week cycle helps to keep people on track and set their intentions on Monday and help them carry out that intention and behavior throughout the week, creating that healthy, sustainable lifestyle. This is visuals by Hopkins to show that people view Monday as a fresh start and are likely to start a healthy behavior or kick an unhealthy behavior on Monday compared to any other day of the week. This is what we call the Monday effect. Chronic disease is another tenet of the Healthy Monday campaign. Chronic disease is a very prevalent public health issue. It's the leading cause of death and disability in the United States as of now. In 2019, 60% of adults had one chronic disease and 40% had at least two, and it's costing the United States a lot of money in healthcare costs. This picture below just notes 7 relatively common chronic diseases. You may know someone who was struggling with one or maybe more of these, just again proving how prevalent and pervasive chronic disease is in our society. Chronic disease is also preventable and modifiable to a certain extent. There are key lifestyle factors for helping or harming your chances of developing a chronic disease, and they are as follows. Tobacco use also includes vaping now. Poor diet and nutrition is also a risk. Lack of movement or physical activity, and excessive alcohol use. These are all lifestyle risks for developing a chronic disease. But it's also really important to note that health is more than your behavior, and there are larger structures at play which have an impact upon a person's health and long-term health outcomes. They are the social determinants of health, the structures in which we live, age, work, and play in our society. So there's 5 of them. The first is economic stability, just noting the socioeconomic class that you are in. Your social and community context and neighborhood and environment plays an important role. If this refers to your built environment and your social infrastructure, so do you have sidewalks that you can walk on? Are there parks for children to play at? Are there community gardens? These social infrastructures help to invoke positive impacts and tend to improve a person's health outcomes, whereas if someone were to live in a dangerous or impoverished part of a city, then that might have more detrimental effects upon their health. Healthcare refers to access to healthcare, healthcare literacy. Do you have access to a physician? Do you have healthcare coverage to afford a doctor's visit? And if you are in that office, do you know the right questions to be asking your physician? Are you comfortable or confident enough to do that? Education is also a very important factor which affects your long-term health. So here at the Syracuse University Learner Center, through the Healthy Monday campaign, we try and support our community in developing approachable and sustainable habits towards an overall healthier life. And we do this by using Monday as a tool, as a day for people to set their intentions for the week to, again, help carry out that behavior, creating that sustainable change. We do that through programming on campus and in the community to support general well-being, and also through our Healthy Monday tips and information through our newsletter, social media, and website. So you'll see later that some tips that I refer to. SID's team in New York creates these national Healthy Monday tips and graphics, and then we disseminate that information through our communication channels. Our first program that we'll dive into is the Monday Mile. The Monday Mile is a 1-mile route mapped out with directional signage, which guides people on their walk, but also identifies a publicly accessible and safe area for people to not only engage in that physical activity, but also to socialize and congregate. So the Monday Mile not only has that physical wellness aspect, but also touches on the community and camaraderie aspects as well. The Monday Mile is an approachable way to set fitness goals. This would be for someone who is just getting back into a routine of physical activity, but maybe doesn't want to commit to an 8-week intense workout program or even a gym membership at this time, but walking a Monday Mile is free and accessible. We have over 30 between Onondaga, Madison, and Oneida counties, and most of our Monday Miles are accessible and inclusive for people of all abilities. We've layered on programs with the Monday Mile, one of which is Monday Mile with a Mission. Essentially, a group of people walk to support their charity or organization's cause. So you'll see in the bottom right here that we did a Monday Mile with a Mission for the Remembrance Scholars at Syracuse University. We've also layered on another walking program called Walk with a Doc, where a physician gives a brief health talk on their specialty and then leads a Monday Mile walk in the community. Those have been very successful in Madison County, as you'll see in the bottom left photo. We've also developed QR codes to help track participation of the Monday Mile and to identify which routes are the most popular. You'll see in the center photo that Dr. Berg is checking into her Monday Mile. These are Move It Monday tips that people can follow. Each tip also is linked to more information on the moveitmonday.org website. Meatless Monday is an initiative to encourage the consumption of plant-based whole foods like fruits, vegetables, whole grains, and beans. Meatless Monday is a day to encourage people to be mindful of what they're eating, to add more color to their plate, and to try a new plant-based food that they may not be familiar with. Just encouraging healthy eating, balanced eating and to be aware of what you're consuming, the food and fuel that you're putting in your body. Here are some Meatless Monday tips, also available at meatlessmonday.com. You'll see that they touch on the environmental aspects of going meatless as well, along with ways to get your protein intake through plant-based foods. De-Stress Monday highlights Monday as a day to start fresh mentally and emotionally. They have a lot of tips and practices to reduce stress and shift your mindset to a more positive lens. Most of their tips have to do with different mindfulness practices, meditations, ways to incorporate kindness and gratitude into your day-to-day. At Syracuse University, we have a meditation every Monday of the semester and a 5-week workshop series called De-Stress for Success for students, faculty, and staff to learn tips to improve their overall well-being. Here are some De-Stress Monday tips, also available at destressmonday.org. Quit and Stay Quit Monday is our last program. This is for people who are looking to quit tobacco or recommit to their quit journey. Quit and Stay Quit uses Monday as a tool to help people begin their quit and also recommit or celebrate their progress. And here are some quit tips, also available at iquitmonday.org. So here are some ways to stay connected. You can sign up for our Healthy Monday newsletter or check out more information about the Healthy Monday campaign at learnercenter.syr.edu. If you're local, you can attend our Healthy Monday programs, or if you're not local, you can organize a Monday Mile with a mission wherever you are, and follow us on social media.